Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like for us to use it on the air. The question tonight is, how do I know if a spot on my body is skin cancer? Asked by Ms. Susan Thomas of Lexington, Kentucky. And here to help me answer that question is my next guest, Dr. James Lagrew with Dermatology Consultants. Welcome.
Thank you.
All right, you talked about skin spots. Are there warning signs that one type of spot is worse than another?
Sure. So the key warning sign that a spot could be a skin cancer is something that's new or growing. So we tell patients to look for a spot that they don't recognize, something that's new and that persists at least for a matter of usually months or longer. So something that comes up for a matter of a week or two and goes away typically would not be a cancer.
Is there a certain size that you worry about?
So the key thing I tell my patients is something that you notice increasing in size. So we often want to catch cancers as small as possible. So the scar and the treatment will be as easy as possible. But if a spot is new and increasing in size consistently, that is what we want to look for.
Color make any difference?
So color makes a difference, especially for melanoma, which is the cancer of the pigment cell. So if you see a mole or a spot that's changing color, or particularly a mole that has more than one color in the same mole, that can be a sign of melanoma or skin cancer.
How about the way it's made? Does that make any difference?
So I guess other features similar to that would be bleeding or ulceration. Cancer cells are adhering to each other poorly, so they are easy to make into an ulceration. So something that's growing like that or bleeding can be another sign.
Okay, so I mentioned sun. We haven't had a lot of that lately. It's
Right.
been raining.
Yeah.
But if we do get sun, that's a risk factor for skin cancers.
Exactly.
Are there other risk factors or other concerns to help prevent skin cancers?
So sun is definitely the biggest risk factor, especially the one that we can modify. Other common risk factors include family history, like for many other types of cancer. So people with fair skin, with a large number of moles, or who have parents or siblings who have had skin cancer, are people who are at increased risk.
Now, sun you can prevent with sunscreen. I guess, is sunscreen still okay?
So yeah, there's been a lot in the news about sunscreen and a lot of controversy over the past couple months, it seems. One issue that's come up is potential damage to coral reefs. So we've heard Hawaii and Key West actually have banned a few sunscreen ingredients. Patients might have heard of that. And the second more recent thing that's come up is that there's evidence that some sunscreen ingredients are absorbed into the body, and the FDA is actually looking into that more to try to determine if that is actually causing harm. To avoid that, patients can look for a physical sunscreen. So common physical sunscreen ingredients are titanium dioxide or zinc oxide. And if they look at the back of their bottle of sunscreen under active ingredients, those are always listed so they can know what the actual sunscreen ingredients are.
If you're looking at sunscreen and you're looking at what they call the SPF, is there a certain number we should look for, or are they all the same?
Well, usually we tell patients SPF of 30 or higher, and that number comes from the factor of versus your skin without anything on it, how much longer it should take for you to have sunburn.
Let's talk about some skin lesions or cancers. There's some precancerous lesions.
So many skin cancers arise first as a pre-skin cancer, we call them, which the medical term is actinic keratosis. Commonly these look like scaly or red spots on the arms or face, and many skin cancers originate as those, so we often try to treat them before the horse gets out of the barn, so to speak, when they're still in the pre-skin cancer phase.
You say treat them. Tell me how.
Yeah, there's a couple different ways. If a patient just has a few of those spots, it's simple to freeze them in the doctor's office. If a patient has a large number, commonly we treat them with a cream that's actually chemotherapy cream, and it just kills those bad cells before they get going. And there's another treatment we do in our office called photodynamic therapy, where a patient is treated with a medicine and then a light activates that and kills the cells by that mechanism.
There's other types of skin cancers also.
Yes, so melanoma is the big one that's separate from what we call non-melanoma skin cancers, like we've been talking about, and those typically arise from the pigment cell either as a mole or just one of the pigment cells that's not as a part of a mole in your skin.
That's treated by surgery?
Yes, so the standard of care for a melanoma at minimum is surgery, and then if depending on features, most importantly the depth of the root, how far the cancer is growing into the body, the lymph nodes are sometimes checked, and if it has spread to other parts of the body, we would add to that chemotherapy or immunotherapy.
So if your fair skin's got a lot of moles, got changing moles, sun damage, they ought to see you to make sure it's not something bad, and if it is, get it taken care of early.
Absolutely.
Thanks for coming in. Thanks for sharing.
Thanks, Dr. Fox.